Hey guys, I'm Dr. Ruth Roberts. I hope you're doing well. I'm the creator of the original Crock-Pet Diet. And sorry I was not able to get on last week. As I said, I had a family emergency. My mother had a heart attack, and I am grateful that it was very mild. And this is where modern medicine is truly amazing. When you have an urgent situation like that, this is where it shines. So the awesome thing is that they were able to place 2 stents via a catheter in her wrist. Crazy. Used to be open heart surgery, right? And didn't have to anesthetize her. And she felt immediately relieved and better. So the upside is that she's back at home. Esau. And doing really great. Esau is very happy with his new porch, so pardon the barking, but so it goes. Stop. At any rate, so again, much gratitude that my mother is back at home safe and happy. She's going to start cardiac rehab, and this is what's really interesting too, is what people are beginning to be told post-heart attack is very different from what they were hearing even 5 years ago. So she's being given information about how to prevent another heart attack, how to improve her health, diet, which I don't quite agree with, but nonetheless it's at least they're addressing diet, which is awesome. And they are addressing how does she feel? What are you doing in life that you enjoy? What are you doing that you don't enjoy? What do you want more of? So that's fantastic that they're starting to incorporate the whole person in aftercare from a very frightening experience. So yay mom, yay modern medicine in this, one up for them. Yeah, thanks. So the upside too, so last week was crazy. We moved, my mother had a heart attack, I flew to Louisville, got her home, flew back to South Carolina Friday thinking I was going to have to evacuate for Irma. Thankfully, many prayers, and never mean to wish bad on somebody. We had quite a bit of flooding in the South Carolina area, but thankfully we were spared the full impact that people in Miami and oddly Tampa and then Jacksonville got really slammed by this storm. And in fact, it's still going up through the center of the country. She lives in Louisville. She was dealing with Tropical Storm Irma, actually probably tropical depression. My mother, that is, yesterday. So this storm is enormous and horrible. A lot of folks are wondering, what can we do to actually help? And so what I would say is the ASPCA, because it is affiliated with so many shelters across the country, that is the place to go. And I'm going to give you a link to their website that will ask you to give a donation. Because it's insane. There are so many people in Miami that just tied their dogs up and left. And once things kind of get back under control, the authorities there are going to try and prosecute some of these folks. Something like 700 dogs have been taken from the Miami-Dade area up to an emergency shelter in the Spartanburg, South Carolina area, which has, I didn't even know this thing existed, but they have a 40,000 square foot emergency shelter specifically for this kind of issue where the resources are just stretched way too thin, and it's a big issue with abandoned pets. So again, yeah, I know it's embarrassing, isn't it? But it's so hard. The other issue too is that the pet-friendly shelters in Miami ran out of space like hours into the major evacuation, and so they were taking people's pets in, but they couldn't accommodate the people coming in with them. So I think they had a much better game plan together post Katrina, because they saw all the horrible things that happened there, but still the sheer number of people and animals were just overwhelming. So again, I'll put a link to the ASPCA website, but I think that's where your biggest impact is going to go. This one is sort of just general donations. They may have some place else where you can send specific donations, but this will help not only the folks that just went through Irma, but also the folks down in Houston and the Gulf Bayou that were impacted by Harvey. So those pets, I mean, they've sorted through some of the mess, and so they've gotten many of those pets into shelters. But again, same situation, many of them abandoned. Really sucks, really sucks. But, you know, all we can do is help as much as possible. So I'll, again, put that link down there and we'll go from there. The other thing that's cool is that the SPCA actually has an app that you can get. So if you're in a hurricane-prone area, if you're in a flooding-prone area, it will help you figure out what you need to do to be able to prepare to evacuate with your pet. So that's really important, because often we don't think out a game plan about that until we're in the middle of it, and then we're running around like chickens with our heads cut off. So for instance, when we were going to have to evacuate, you know, we've got 4 dogs, 2 cats, we've got 2 small cars, so we set up to rent a minivan, found a place in North Carolina that we could take everybody to, you know, pack up all their food, all their stuff. You know, MJ, bless her heart, had all this stuff ready to go. I'm trying to get back to Charleston from Louisville. But we had a plan laid out, and we knew what we needed to do. So right now, it's chilling. Hurricane season is not over, and you know, spring rains and things like that, I think that's when the Midwest has more trouble with flooding. Put your plan together. Give yourself a target date. Make it October 15th. Give yourself 30 days, but get your plan together so that if you get into a situation, you're ready to roll. Hey, Vicki, good to see you. Glad you're popping in. So that's what I know about emergencies and evacuation. Get yourself together. Had a couple of questions that I wasn't able to get to last week. Julie sent in a question about how to help get her perfect dachshund to quit barking. He's so smart and knows a lot of commands, but they just cannot get the barking under control. And that is a common problem. So you just heard Esau, and he was doing his job. A car went by, and he said, "Oh, there's a bad thing out there potentially," and then he stopped. And Mona often does the same thing, and she is a little mini dachshund. She incidentally thinks that her new accommodations are just spectacular, and Esau also liking the porch. So we're hanging out outside. They may bark periodically, so I may have to change places to broadcast, because they simply haven't seen traffic before. But here's the thing to remember. What I asked Esau to do, what I told him to do is, okay, we're good. You told me it was a potential concern, and then I gently put my hand over his muzzle, just like this. This is the leader dog in the pack saying, "No, sir, this is not acceptable." Sometimes that works, sometimes it does not. For dogs that are very dominant, it tends to make them get more riled up. The thing to remember is that if they're barking and you're like, "Stop it, stop it, stop it," what you're doing is reinforcing that behavior. They got you to give them attention. Even if it isn't hugs and kisses, you are now paying full attention to your dog and yelling at it, trying to get it to stop to bark. That's not going to work. They are really, really smart. And if your Doxy has figured out all those crazy, you know, all the commands and all that good stuff, he has figured out that he is manipulating you. So, deal number 1 is get a remote control device, so to speak. So, squirt bottle, that's a great thing to do. Maybe put a couple of drops of lavender oil, because it seems the scent seems to startle them a little bit, and it is calming, but it just kind of resets what they're doing. Correct them once. It's just like kids. If you're across the room yelling at them to stop it, stop it, stop it, they're like, "Yeah, whatever, you're not doing anything about this." Get up, ask your dog to do something else. So ask him to sit, ask him to come, stop, you know, distract away from the behavior that you do not want them to do, in this case, barking. If they are barkers, you know, and this is another great place where a trainer can help you out tremendously. But it's definitely, it takes some patience and persistence. So just like kids, they know if they keep chipping away at stuff, often we're just going to give up and surrender. And this is where you need to, you know, keep on target and on task about what you're asking your dog to do, so that you make it abundantly clear that no, this really isn't an option. We're going to stop barking and we're going to go do this thing over here and distract you from what you're doing. So that's what I would do for that situation. And Vicki, I hope that works for your 12-year-old Schnauzer, that's a tough sell. I mean, you know, for goodness sake, that pup is 117 almost. And so, you know, it's like a, you know, at 97, how much behavior change are you going to affect? Maybe not so much. But try those tricks, because you can teach an old dog new tricks. But make it so that it's not stop it, stop it, stop it. It's stop it, please, and let's go do this. And so you've interrupted that thought pattern for your dog, and they're like, oh, toys. So, you know, literally use that squirrel mechanism to distract them away from the behavior you don't want. So that's what I would suggest starting with. For dogs that are barking when you're out of the house, the tough thing is you're not there to correct them. And so what do? There are shock collars. There are citronella spray collars that work really well. They have something like an 85% efficacy rate as far as stopping problem barking. Plus, when you get home at night, your dog will smell lemony fresh. Just kidding. But that's an option to check out as well. So there's tons of information about that on the web, but I think Inotech is the one I last saw manufacturing the citronella spray bark collars. As far as working with a trainer, you know, the more specific you can be about the issues that you are having, and the more willing that you are to see the things that are kind of perpetuating this situation by setting up your dog to continue to bark, then the faster you're going to learn, and the faster your dog is going to learn as well. So that's what I've got about barking dogs. The other question I had from Lisa, sorry, and I used to be able to see Sky and Sunny in her practice, and I think the Springer's name is Sunny, and he is a very sweet, very handsome, soft guy, but very worried about everything. And he's had some allergy issues, as Springers are wont to do, unfortunately. And unfortunately, the ears are often affected. So here's the thing to remember. The ears, inside the ear, is an extension of the skin. The issue is that it's now in a very much warmer, damp place. And so that's why ear infections can be a real bear to get rid of. So two things I'm going to say about that. We're going to talk a little bit about food rotations and things of that nature, and also some kind of palliative or things to help keep things under control. The second thing I want you to remember about chronic ear infections is that if you look at a picture of the ear canal, so you've got a long tube like this, and at the bottom of the tube, and actually you've got an L-shaped tube, which is what makes it even more, sorry, I'm not a good graphic person, even more difficult. So you've got this L shape coming down to the eardrum here. So what you can see from the outside is about right to here, about to that bend of the L. And then what I can see with an otoscope is down to the eardrum. And so what I've found with many dogs that have had chronic ear infections is that part of the reason that it's chronic is that that first one never got completely treated. And often what has happened is the eardrum or tympanic membrane is extremely thin, and if it is inflamed and there's infection and evil grossness down there, it gets really friable or fragile, and so it's easy for that to pop. So often what happens with chronic ear infections is that that eardrum has popped, and some of that gross goo, which is bacterial, yeast, God knows what, in there, has actually gotten into the middle ear. So we've got this membrane that's got a little loose spot, so we've got a little place where it can go into that middle ear, and then everything calms down, you get the external part of the ear infection cleaned up, and then that membrane seals back over. Well, now there's gross goobers stuck behind that eardrum. So that's often part of why we get recurrent ear infections as well. The only way to know that that has actually cleaned up completely is to really go back to your veterinarian in 2 to 3, 4 weeks. I mean, I know it seems like we're asking you to do rechecks and, yeah, we just want you in the office to make a couple of bucks, but that's not the truth. The truth is that in 2 weeks, the ear infection is going to look a boatload better, but chances are good that it is not completely resolved. So I will often ask clients to come back in 4 to 6 weeks to make sure that that eardrum is intact and that there is no evidence of grossness, pus, yucky stuff stuck behind the eardrum that may create an ongoing issue. The other thing is that in 2 weeks, things may look great, but in 4 to 6 weeks, it still may not be completely healed. And we may also see an open eardrum, and so that's going to cause us to use different types of medication to help heal that up. So I hope that makes some sense. But that's where, if this goes on and on and on, there's a couple of things you want to think of from a conventional standpoint. One is, doing cytology to see if it's yeast or bacteria and what type of bacteria are present to help, again, target therapy better. The second is that if your dog is getting chronic infections, many times we actually have to sedate these guys and flush their ears out with a saline solution. And in many cases, we finally get down to the eardrum underneath all of the medication you've been putting in for the last several weeks, because that's what you've been asked to do. So we get all that junk flushed out, and then there's this kind of skanky looking eardrum with grossness stuck underneath it. And so at that point, what I would often do is lance that eardrum and flush the middle ear out with just plain water, and then put in a little bit of a steroid for 2 reasons. One is now to help take down the inflammation and discomfort, and then the second is to go ahead and help start to dry things up in there. And then we're able to do a bacterial culture and sensitivity if there is still bacteria present, to make sure that the appropriate antibiotic has been used to treat the infection. And because most veterinarians get on one ear medicine and we use it and use it and use it, all of a sudden we start to see resistant ear infections to that particular antibiotic. So culture and sensitivity, make sure that we've actually got the infection killed, get rid of all the grossness so that we're starting out with a clean situation, and setting your dog up for success rather than failure. And then closely monitoring to make sure that everything is proceeding as it should be. Yes, that's expensive, but on the other hand, if we can take care of that on the front end and take care of that in 2 to 4 weeks versus treat an ear infection for the next 6 years, hands down, best way to go. Now, one of the things Lisa was asking about was food, and she said that she had used some different types of lamb and things of that nature. And sorry, Esau's really enjoying his porch, so we may be on the back porch next time. At any rate, so she's tried several different foods, and I think that can be very important as well. So when you're doing a food sensitivity trial, a lot of people will go out and buy a bag of lamb and rice, or beef and potato, or pork and potato, whatever it is. The deal is, first, read the label, because it may say lamb and rice, but then it has chicken and soy and all this other stuff that you're actually trying to avoid. So make sure that it truly is lamb and rice, or fish and potato. The other thing to remember is that multiple studies have shown that specific ingredient diets, by and large, and I'm talking to the tune of 90 some odd %, are contaminated with a different protein or carbohydrate source that you're actually trying to avoid. So this is the other frustrating thing. We try this lamb and rice diet, or we try this fish and potato diet. Pet owners tell me this all the time. They've tried several different diets in a row with no success. We look at the label on the internet and they're like, oh, it had chicken. So that's, again, where the Crock-Pet Diet is really useful, because you can get, you know exactly what's in there. So you know that it is only fish and potato, or lamb and rice, or pork and quinoa, or something. You know exactly what you're doing. The other thing to remember too is during a food trial is to avoid commercial treats. Only use treats that actually match the carbohydrate and protein source you're feeding, so that you're not giving your dog this expensive fish and potato food, but feeding them bacon strips, because that's just going to kind of defeat the purpose. You've just reintroduced all those potential food antigens that were there. So that's definitely a useful thing to do. Again, gut health is important here, and I know I'm probably banging the drum once more, but if your immune system, over 75% of your immune system is in your intestines, if that is not working well, and your inflammatory mechanisms are all cranked up in the gut, if that's activated already, and then you get an ear infection on top of that, the immune system is just sort of overcranked, and you're not able to get that. Your pet's immune system is not able to get the ear infection under control, either because it's sort of being overused in the GI tract, or conversely, again, if you've got leaky gut syndrome due to kind of chronic dysbiosis in the gut, it doesn't always show up in the gut. So this may be the result, this ear infection may be the result of your pet's dysbiosis. So again, clean up the gut, get that as strong as possible. We've seen dogs were, given oral probiotics and fish oil, and cleaning up the diet a bit, boom, massive improvements. So that's another good trick to follow. The other thing that's important is if you are, your dog may have environmental allergens. So right now, mold counts are off the charts again because it rained, and unfortunately many people in the Charleston area had a terrific amount of flooding. And so as it dries up and warms up, and there's still moisture in the wall or in the carpet and that kind of stuff, mold is just going to take off. We're starting to get to the point in South Carolina where the trees are going to start dropping leaves. Other animals have allergies to that. So the other thing to remember is that, again, the inside of the ear is an extension of the skin, and so it may be environmental allergies and not food allergies that your pet is responding to. And if that's the case, then that's where, again, I would use sort of my standard allergy protocol, and that's going to be probiotics, fish oil, quercetin and stinging nettles, and cleaning up the diet as best as possible. The other thing that's massively important, and the thing that your dog is going to hate the most when the ear infection is most painful, is getting all the scrunge out of the ear on a daily basis. The more gunk that sits down in that L-shaped ear canal, the harder it's going to be to get rid of the infection. So when I was talking earlier about flushing out the ear, and said after I flushed out all the medication you've applied, this is what happens. It's uncomfortable. It hurts. And so, at least the first several days, I'll often say, don't worry about cleaning the ear, but once that ear is comfortable, then start cleaning. And there's a few codicils to that, which I'll explain in a few minutes. Clean out the Gras-Du first. Find an ear solution that doesn't bother your dog. The acetic acid ones, which is basically a form of vinegar, if that ear is lit up, it is painful. So ask your veterinarian about a different type that's more comfortable, that's got some boric acid and a few other things. One of the ones I used in practice all the time is canine ear solutions. While it is alcohol-based, it does have boric acid and some other things that neutralize the discomfort from the alcohol. And then the other thing is it has gentian violet in it, which kills all sorts of organisms. So the idea is you clean the ear out, fill it up with Gras-Du, with this cleanser, massage it. This is definitely an outside job. Massage it, let your dog shake, wipe out all the yuck that comes out. And really, again, we've got that L-shaped ear canal. We're using the massage on this part to loosen up the yucky stuff, to sling it up here where we can actually get it wiped out. So try that. Gentian violet is purple. Do this outside. Another tip that's helpful to get the ear cleaning solution into the ear is that often you pick up the bottle of stuff and the dog's like, done that, know what it is, not having it. Get a little syringe, and you can get these at the pharmacy now or what have you, just a little dosing syringe. It takes about 1.5 ml of ear cleaning solution to fill up the ear and massage it. That's often much easier to get the stuff into the dog's ear. The other upside is that you can warm the solution so it's not cold and stingy too. Again, if your dog's had a really horrible painful infection, wait 2 or 3 days before you start cleaning, and do just apply the medication. As soon as the dog starts scrunching down, when you apply the medicine and massage the ear canal to get it kind of worked in, that's when to start thinking about cleaning the ear. Now, the codicil to that is there are several new ear medications available that last for a couple of weeks. And they are awesome. So for a dog that has such hideously painful swollen ears, this stuff is great because it gets in there, takes the inflammation down, gets the pain and discomfort under control. That is where you do not want to start cleaning until you have been back to see your veterinarian and have been given the all clear, if you will pardon the pun. So kind of keep that in mind. And, and again, go back for that 4 to 6 week follow-up to make sure that the ear really is cleaned up completely and that that eardrum is intact. And then after that, maintenance-wise, I would use, something like the Canine Ear Solutions on a monthly basis, bi-weekly basis, depends on your dog and allergy season. But anyway, use that on a regular basis to help get the yuck out of there. If there's less organic material, less moisture, less goo, less easy for an infection to set in. If your dog's ear infection is due to environmental allergens, I mean, sometimes they're severe enough that we'll actually use hyposensitization therapy. And again, Heska does a blood test for that and then has oral hyposensitization therapy available, which I think is a much better route. So that is for very severely affected cases. That's been a great help. Otherwise, just knowing what you're dealing with. It's fall, so we know that we've got leaves, mold, and grasses. If your dog is allergic to them, keep cleaning them once a week. Clean those ears out once a week to help prevent yucky stuff from setting up shop. Again, with the Gentian Violet and the Canine Ear Solutions, it helps to kill back any infection that may be present. So I think that's what I got for you on ear infections. So Lisa, that's kind of the thing. If this is chronic, get somebody to flush that ear out. Make sure there's not something going on in there. Kind of see if you can match it up to allergy season, fleas, what have you, what the inciting thing may be. And then double check the brands of food that you rotated through to make sure that they really were single protein, single carbohydrate diets. And if not, then pick something novel, or again, do Crock-Pet, and just stick with that. And Lisa I've known for many, many years. She had a very old Goldie that ended up, it's just a doll, ended up developing cancer, and Crock-Pet is part of how we got that to kind of be as quiet as possible. It was also really useful for the arthritis that pup had too. So I hope that helps. I think that's all the notes I've got for you today. Again, I'll put the link up to the ASPCA website so that you can go check that out and get some of these folks, and well, the dogs and cats down in the Miami-Dade, Houston area some help. Have you guys got any questions? And Sally, it's good to see you. I'm glad you can make it. I think you're getting close to being retired, I think you said. So glad you can make the broadcast every week, and hope that this is helpful. If you don't have any questions, I will see you next week. And please, in the meantime, if something pops up you want to know about, just message me on the Facebook page, on the Dr. Ruth Roberts Facebook page, or through the messaging system. Email us at support@theoriginalcrockpetdiet.com, whatever works for you. Until next week, remember, your pet's best health starts in the bowl. Take good care. I'm Dr. Ruth Roberts, the creator of the original Crock-Pet Diet.